Hello everyone, I'm KH Kim from Asan Medical Center. I would like to talk about open right hepatectomy, including open living donor right hepatectomy. I will introduce an operative procedure for open right hepatectomy. First, there are various kinds of skin incision, including J-shape or reversed L or inverted T incision. Second, cholecystectomy is made. In this video clip, reversed L incision was made. Tumor was located on the right side of the liver. A reverse L incision was made. I will show you a video clip for open living donor right hepatectomy. You can see the right hepatic vein and right anterior, right posterior portal vein, and this male has a right inferior hepatic vein and normal right hepatic artery, a very short right portal vein, and classical bile duct.